All right, well, we can go ahead and get going. We may have a few more people join us. I know at least one person will be hopping on kind of midway since we're a little bit longer than normal today. But I do want to start and have Kate, if you don't mind me putting you on the spot, if you can do a quick introduction. We have a new member with us.
Sure. I'm taking kids to therapy right now, but my name's Kate Rickenbaum, and I am the family delegate-elect for the Maternal and Child Health Bureau for KDHE, and I'm a family advocate. So I serve on several boards within the state, and then I also am on the Family Advisory Board with Children's Mercy, and I do a lot of work for my kiddos, and that's kind of my kids we adopt. My two oldest kids we adopted out of foster care, and they have a lot of special health care needs. So that's kind of how I got started in this.
Thank you, Kate. Welcome. So today we will revisit our Jamboard and do a little refresher of where we left with ideas. And then the hope for the session, we've got a little bit longer, is to have a good sense of what type of recommendation this group would like to put forward after the November meeting. So ideally, we'll kind of start making a list, whether that's one or two, and then use the November meeting to really kind of put some specifics. I think there will likely be some sort of template that will complete at that point. Does that sound good? We feel ready to jump right into that? Great. Can everybody see the Jamboard? Great. And for those who don't have the link handy, I will put it in the chat. Okay, so I did a little tiny bit of kind of trying to group some of these ideas into common themes. So I thought we could start by just kind of walking through, getting a refresher of where we are, and then talking about what feels like something that could be developed into some sort of recommendation in the next month or two. So some of the themes are, we had a couple people that noted like family stipends or some sort of incentives for people to be more engaged. So I know one thing that has come up in my work fairly recently has been, could there be some sort of like recommended guidance around range that across different agencies, if a family is interested in being involved in some way with early childhood, there's kind of an expected range for a stipend so that there's some level of alignment. So I think that could be one possibility, but certainly there could be a lot more to discuss with any sort of incentive or how to compensate people for being involved. There's also discussion around like a one-pager. I know we shared a little bit about the toolkit that KDHE will be leading over the next few months, like a directory, some sort of way to help organizations show where there's engagement opportunities and make it a little bit easier for families to know what's available to them and how to get involved. We also had a few post-its around stigma, and then there's the conversation around equity and expectations. And I kind of grouped all these together around just a bigger conversation about what are we expecting in terms of family involvement, and how can we, are there things we can talk about with language and how we approach that to make it feel more equitable and perhaps more approachable for people. We also have a section here about professional development and the need for professionals to be able to learn a little bit more about how to work with families directly. And I'm not sure if that might be like a training course, or if there's kind of some sort of recommended like guideline that all early childhood professionals complete XYZ. We talk about more what that means. We also had several people share existing resources that could be leveraged as potentially as a training tool or as some sort of framework for our early childhood system. And then we also had a few things about continued connections with other groups like healthcare providers, childcare providers, other community-based organizations, the local interagency coordinating council, and then K-Park. Does anybody have any ideas that have bubbled up over the past few weeks that they want to add to this?
Megan, this is Nikki Adams. I would like to mention that in our links to quality QRIS system that's being developed, there is a link about family partnership. And so there's training and technical assistance associated with that.
Nikki, do you mind sharing a little bit more about like what that would look like in terms of how people can access it?
I'm not sure I understand what you mean in terms of how people can access it.
Well, I guess, can you talk a little bit more about like what is in, you said it's a training, correct?
So when links to quality go statewide, one of the links is on family partnership. So as the providers are working on that link, they'll have supports in place to help them with training and technical assistance as they work through some of the indicators that they're working well with their families.
Thank you. Anything else?
Megan, to answer your question on kind of based on these themes that you've identified, I really keep going back to the idea of a one pager. I really go back to the idea of we have all these resources. We have 1-800-CHILDREN. We're going to have this family partnership links to quality. We're going to have this toolkit. Really, how do we get these to families? How do we get them to providers? So that's really where my mind is connecting the dots. And so I do think that it's got to be based, in equity. And you mentioned like removing stigma. So I do think that has to be like central to an effort in this way, but I hesitate to work on something that's already been done, and even recently, and in a very qualified group of people. Excuse me. So that's really where my mind is how do we get the great resources that Kansas has to people.
I'm seeing some nodding, so I don't think you're the only person having that thought.
I would
Megan,
definitely
this is Kate.
second that, Crystal.
Thanks, Natalie. Go ahead, Kate.
One of the questions I have, and forgive me because I'm new to this group. So by providers, are you talking, because you're talking about wanting to get this one pager in the hand of providers to also get it in the hands of families. So which providers are we talking about? Are we talking about early childhood providers? Are we talking about medical providers? Are we talking about all of them? So what's kind of the thought process behind who's going to get those?
That is an excellent question, and I think worth a discussion. I think that is a term that we should define within the group. So I would love to hear what other people mean when they say, when they're talking about providers.
I can kind of speak to providers from my experience with our local ICC. We term providers everyone beyond the professionals sitting in the room. Childcare, doctors, anyone who touches a child or a family. And the bad part is there are so many avenues. You can't just put an ad in the newspaper, or you just can't send an email home, or you can't make a phone call. You kind of have to take a 5-finger marketing approach to it and use all of them. Because you're not going to get more than 20% in any one of the categories. And putting the information out there doesn't necessarily mean that they're going to get it in one place and they won't get it in another. Child find efforts, I know, with ICCs are a big part of their grant and duties, and this kind of follows in line.
Thanks, Lisa.
Megan, this is Vicki, and I'll admit when I was talking about providers, I really was talking mainly about childcare providers, because that's what we talk about the most, right? And like, I'm the early education and childcare services manager, so that's just the kind of view that I come at it with. So I'll just admit that. But you're right, it could be, everybody can see that differently.
Absolutely. And I think, sorry, go ahead, whoever was.
Okay, this is Kate. So from a parent perspective, kind of what I would see, I would see medical providers, childcare providers, anyone that does any type of therapy, so occupational therapy, physical therapy. So like the early, the Tiny K programs are a part of that. Looking at involving the MCOs in getting information out and disseminating information to families. So I think, like everyone has said, I think it's multifaceted, and I think in order to do it well and to do it right, we need to utilize as many resources as we possibly can. So, looking towards, working through organizations, professional organizations, how their licensure is, et cetera, to find those providers and get information out, I think would be key to making something like that work and be effective.
I know you can't see it, Kate, but there are several heads nodding.
And can you tell me what, I'm not sure what NCO is.
Medicaid, so the Medicaid providers, so Aetna, Sunflower, and United Healthcare, they send out a lot of stuff. So I think, they're kind of a logical step for that.
Thank you.
We've got about 5 minutes before we'll take a break, and then we'll come back and have about 40 minutes after that. Are there other, before we kind of get to narrowing down what we feel like could be a recommendation to flesh out, are there other ideas or areas that feel like you're really interested in talking about?
Megan, this is Nikki again. I did want to share. So we put out an RFP for family needs and preferences study. It is again related to childcare needs and preferences. The RFP is for a study of parents, but the focus for this is actually on our childcare subsidy program. But it will ask questions about why parents are making the choices that they're making about childcare and other things. So I just wanted to share that today at some point. And I know that's not exactly on topic, but it's something that's happening, and we can use that information in multiple ways.
Thanks for sharing that, Nikki. Do these themes still feel right to people? Does this feel like the right direction for the group? You know, we'll talk about kind of how we want to narrow them down and what this looks like in terms of a recommendation, but does this feel like the right path still? All right, I'm not hearing any objections, so I'll take that as a yes. I think we are you okay with taking our break just a couple minutes early, and then we'll take 10 minutes and then come back at 10:07 and then try to take this Jamboard and turn it into some at least initial bullet points for a recommendation or something that we would like to put forward from this group. I'm good. All right, well, enjoy your 10 minutes and we'll see you back here at 10:07. Thank you. Hey, Cora.
I'm still here, but hi.
Simple.
Yeah.
It feels like it's been a little bit.
It does, yeah. But also, yeah,
I'll see you tomorrow too.
yes, that's true. I'll let you take your break.
All right, thanks for being here. Appreciate it.
Of course, yes.
Welcome back. Gail. Hi, Heather.
I went to the wrong room.
Well, yeah, we're just coming back from break, so you timed it perfectly.
I got into the room. I was like, none of those people look. Well, I mean, a couple did just because I know them, but I'm like, they're not in the group I'm in. Where am I at?
It's easy to do.
And it dawned on me there were 3 work group meeting rooms.
Well, we're glad you made it here.
I need to go back to bed.
It's like when you go to the wrong class in college. Was not supposed to be in physics today.
I didn't sign up for underwater basket weaving. This isn't.
All right, I think we are all back. So I know Gail and Heather just jumped on. We spent the first part of our time together kind of reviewing the ideas and talked about some themes. And now we have until 10:50, which is when we'll go back to the full group to try to brainstorm what of these do we feel like can be developed into some sort of recommendation. I think Debbie provided an overview of what that might look like, but don't worry too much about like implementation or the super details of a recommendation. I think focus more on the general idea that we feel like is something this group would like to put forth following the November meeting. So we'll have some more time to flush it out next month, but that is the goal for the next 40 minutes. So does anybody have thoughts on like what I know, Crystal, you shared really being mindful about how do we make sure we're connecting existing resources and really getting them into the hands of people that need them. That seems to be an area of agreement. But are any of these standing out to you as things you'd really like to see this group put forth as a recommendation?
Megan, this is Nikki. I wasn't sure. Somebody wrote, and I'm not sure who wrote, about the Kansas Parent Resource Information Center starting a family engagement professional learning network. I don't know if anyone knows more about that.
I do not. Does anybody on here know more about that? Doesn't sound like it, so that may be a good question to investigate. Some thumbs up.
Megan,
Go
can you
ahead.
hear me? Okay. With a mask on, it's hard. Maybe we could see if somebody could come and present to this subcommittee of the larger group, and then maybe they would present to the full recommendations panel at some point.
Absolutely. I'm going to keep this screen up, but I'm taking notes on all these things. And then as we're ready, I'm going to switch to a different board so that we can kind of put some recommendations, but I want to make sure people can still see these ideas. But yes, we can find out more about the Parent Resource Information Center and see if somebody's available.
Megan. Another thing I was just thinking, it's kind of all over on this, but you know, I know PPS has a contract. I think it's, and I'm speaking a little bit without really knowing what I'm talking about, but PPS has a contract. I think it's with KCSL to build more family resource centers, or to build upon existing family resource centers. Gail might know way more than I do. And so I know that some of that work's already happening. And I think there's a certain number that they're expected to help put into place across the state. And I think a lot of this just touches on that, connections.
Well, thanks, Michelle. Yeah, so really, it's a very small amount for this first year of the contract. We're looking at 3. So when you talk about the potential, it's really small. I think what the work that we're doing that is going to be most helpful is bringing in the family engagement standards from the National Family Support Network. So I was looking back at our Jamboard, and I was thinking, I wonder if that's partly where we start, is a recommendation for a common definition of whether we call that family engagement or family partnership, so that, you know, organizations are working from the same framework essentially, and then maybe spending some time to look at those national standards and see if those are recommendations that we want to, a recommendation that we want to adopt for Kansas to utilize.
Gail, are you talking about the family strengthening and support standards that the Family Support Network has out? Were those the standards you were talking about?
I believe so. I'd have to go look at the website, but yeah, it's through the National Support Family Network. So
yeah. We've been trying to get with them to partner on bringing those to Kansas for a while, so I'm really interested.
Yes, because
If I send you an invite. We tried to get in on that network a while back, but they wouldn't let us because we weren't a freestanding family resource center. So I definitely want to hear more about that.
So
I'd love to get involved.
Yeah. So we attended a training. We sent 2 staff to a training a couple weeks ago, and knock on wood, if all goes well, Kansas will become green on the map because we've, so we will have access to all those standards and be able to use them as much as we want. So yeah, I feel like that's a pretty big win.
So Gail, this is Kate. I've actually been through that training myself.
Oh, wonderful, Kate.
Yeah, we went through it in Cassandra Sines and I went through it in DC a couple of years ago.
Fantastic.
So I think that's a great thing. I think this kind of points out our lack of coordination. Maybe we need to work together to talk about this, since that's something you guys were doing and KDHE has been trying to do as well. So maybe connect and work together.
Yes. That is my hope. Actually,
I know Andrew told me that somebody in Kansas was trying to get in or was talking to him, but he never did tell me who. I've been every once in a while, I'll email Andrew and be like, are you going to let us in yet? Can you let Title V in? We want to be part of it.
Yeah. So Heather, you have been the lead on that. Is that right, with KDHE? Yeah. So our thought was once we know more, that we would then bring some of the state leaders that we know who've been interested in this and have been trying to work on this together to form, essentially, they have to have a state leadership committee. So to Kate, to your point, that would help coordinate that better.
Definitely. Well, let me know when you're ready for us. We're ready to help. We on that note, we did integrate and use some of the standards tools, like the participants survey and then the program like self-assessment or whatever, I think it was called. I can't remember the exact names of the tools, but we used those in our last Title V needs assessment. So we had our local MCH grantees fill out the program self-assessment on how they're doing in terms of family strengthening support. And then they shared the participant survey with some of the individuals served through that. So that was integrated into our needs assessment, and it's written into our 5-year state plan that we wanted to do more about bringing that in. And it's part of the family toolkit, family engagement guidance and toolkit that we're creating for our local grantees as one of the frameworks that they need to look from and build from. I just can't seem to become a trainer because I wasn't an affiliate. So maybe you could make that happen.
Yeah. So yeah.
So we're trying to integrate it.
What we just found out, Heather, is that becoming a trainer of the trainer, I think is going to become even more challenging. I'm not sure that we'll get there because they have been talking at a federal level, a national level with so many states. I think what happened is they don't have enough capacity. So they've gone to a very strict application process now. And I think it'll be a little bit more challenging, but we'll get there. We'll get there.
And we'll get there. But we can do other pre-work before that. Lots to do.
So Megan, I know you're looking for recommendations. So maybe one of the recommendations would be to coordinate between DCF and KDHE and probably the Children's Cabinet around family resource centers and the family engagement standards. I'm trying to loop us back, Megan. We got a little sidetracked.
No, it's good. It's always good when you have organic connections happen in a meeting like this. Okay. So again, some of the other themes that have come up in the past are, and it sounds like some of what we've talked about might help address these, professional development for people to kind of learn more about how to work with families and what that looks like in practice. We talked about kind of the one pager or some sort of resource and how do we either create something or leverage something that exists and make sure it's getting into the hands of as many providers as possible. And Heather and Gail, just so you know, we had a conversation about how broad the term provider can be, that could be childcare provider, that could be community-based organization, that could be healthcare provider. So for the sake of this group, just keep that broad definition in mind. We also talked a little bit about some sort of alignment on stipends or kind of having a recommendation around like if there's a range or kind of what the expectation is when an organization engages with families in terms of compensation. Is there any other recommendations that come to mind? Keep in mind, there's really no recommendation too small either. Like I know sometimes we want to really go after the big things, but there can be small things that can help lay the foundation for that. So think about kind of the effort to impact and what you feel like this group wants to do in the next month.
I'm still hoping to see something maybe tangible on connecting families to the current resources out there, but not really knowing what that looks like. I just think there's an opportunity here with all the representation between families, the providers we mentioned, and the fact that there's just so many great resources that Kansas has. So
yeah, and let's try to break that down. I agree. That's, you know, it feels a little daunting, but I think even one step can be really helpful. So do you feel like, what is that, like a centralized location for information? Is it more like consistent communication pathways between the various organizations? Like, do you have a sense of kind of like, in your ideal world, what would that look like? And we can try to work backward. And feel free to anybody jump in. This seems like, I don't think, Crystal, I do not think you're the only one that's thinking this.
I'll add, can you hear me? Okay. Okay. My headphones keep going in and out today, but I'll add kind of what Lisa was saying. It would be awesome if we had some sort of media presence, but it is hard because, yeah, you have to hit all the social media, television, radio, but I don't know how else to get the word out there. I do wish 1-800-Children or somebody would come up with some media blitz that would kind of cover everything. So that families do know that there is help out there, other than just us passing out the information, which I'm very happy to pass out the information, but I don't think that I'm only hitting the families that we meet. And there's a lot of families out there that we don't meet. So I don't know how to get that information in their hands.
So I think there's two different views on this. We've got like getting information out to parents, but we also need to get information to our providers on how to better work with those parents, which we also have like a plethora of information on. I know I'm working on, this is my third group to be talking about family engagement and how we can engage families and communities. So there's a lot of work going on around it. I think if we can just put it together or put it in a place that's easy to find, all in one place, it would be helpful.
Great. And I think that's a really good distinction that you brought up, Natalie, of, you know, I think there are a lot of layers to this, but are we talking about more resource navigation and actually getting people connected to resources and information and services? Or are we talking more about having a true partnership with a family where it's a dialogue? And I think there can be aspects of both in the same relationship, but I do think that can get a little tricky. So just noting that for the group is something we might want to clarify, or just say that we're talking about all of the above.
For sure. Natalie, I'm curious, you mentioned that there's some other groups that are talking about this. Are they represented in the rec panel and in this work already? So do we need to like find a way to consolidate and bring us all together somehow, or are they too focused in one area, or what?
So I worked earlier with KPERC and this project is over, but that was the Family Engagement Partnership Standards.
Yeah,
that's on their site, which is still available and still a really awesome tool for providers to use to check and see how they're doing with family engagement. There's the Teaching and Leading site for Kansas schools that we've provided some resources and training on how to better connect with families. And then this group. And then I know you guys are working on something too, Heather, for a toolkit. And I'm not sure where that's gone or where that is right now. But so I know that work is going on all over the place. But if we can, and I feel like it's probably represented from KPERC, maybe the the group that we don't have on here right now. And I think they would be the best place to direct families to for resources. That's all I got to say about that.
And I will say they are represented in some of the work we're doing with the toolkit on our end. Well, they were. The person that was representing can't work on our group just told us she was leaving. So we'll get somebody new, but we are trying to integrate both of those other resources that you talked about in our stuff too, just to try to bring things together. So anything that we can do, like for this group that would be valuable, like we're happy to do that. And I'm sure we will be bringing things back to this group and sharing our progress. We have a family advisory meeting actually tomorrow to continue working on getting input from them on some of the resources they know about, the existing like surveys that are being utilized and advisory opportunities that they know about that we could bring into the fold and have conversations about and bring in their resources. So we're still working on gathering all of that. Fingers crossed we'll have something solid to share with you guys in December. That's my hope. No promises. Don't hold me to it. Don't pummel me if I don't have something for you. But and mainly just because I want to share it back with you guys and keep you guys informed on what we're doing so that you guys can help us not duplicate something, because nobody needs that.
So the work that we're doing on the KSDE team, we've been also not creating any new stuff. We're just pulling it all together. So connecting it. So like when you guys are done with your toolkit, we're hoping to put a link in there to your toolkit.
Let's connect.
And just to have everything in one place. We're not creating anything new. We're just putting it all together. So anytime, so that's my feelers out all the time for, oh, we can add that to our site for parent or family engagement.
Awesome.
This is Esther. I'm glad you said that, Natalie, because I kind of had in the back of my mind, we were creating something newer, but to me, to be able to follow that similar format and then put the information that we come together with in that format and have consistent formats for everyone across different topics, I think will be very helpful. So thank you for that clarification.
I think the other thing is it's okay to have it in different places. Like teachers are going to go to this space. Childcare providers are going to go look for stuff in this space. So I think it's okay if we have it located in different places, but that the information is all the same.
Yeah, the consistency across us is really, really important. And I think being able to highlight and connect things in those different ways is going to be just more helpful for all the providers. But then to Crystal's point about wanting to do something for the families too, like where do we come up with that? And how do we do something similar? And I think some of it's the same too. Like some of the resources we're finding for providers are going to also be valuable for a parent if they want to look at them. Not all of them, but for certainly some. So I think it gives us more opportunity to just keep engaging and moving forward and connecting the dots.
I was thinking about the needs assessment findings, and the first three are really focused on family needs. So accessibility, needing to access high quality programs and services, availability, and then navigation is where our conversations have really been about this morning, especially. So families must adopt a connect the dots approach to navigate services across sectors. Disruptors are frequent and common. So I just think, really focusing our efforts to meeting that need would be ideal.
So what was the third one you said? Is it service disruption?
Yeah, like navigating the services. So the findings were that they must adopt a connect the dots approach to navigate services across sectors. And then as a part of that, disruptors are frequent and common. So You know, I think about all our families in Wyandotte County who are constantly moving and locations, you know, and just thinking about what might be stable in families. And is it that, you know, that pediatrician, that physician, or is it XYZ? And I think it's so easy for us to be in our where we're at. You know, I partner with centers, but that, you know, that only gets to our families in the area who have children in childcare. And, you know, what about everyone?
Absolutely.
Oh, Esther, I was wondering what kind of codes you were sending us.
I just looked and I saw that and I thought, who wrote that? What does that mean? And then I thought, I wrote that. Oh, that's a good thing it's Friday, right?
It certainly is. I do want to go back to Gail's idea of like a common definition, as well as we're having really good conversation about consistent language. And I do wonder, I mean, that conversation has come up with the family leadership team, and I know Heather and Cora, I've had that conversation with them. So I'm curious, do others feel like that would be one place to start? Go to yes in the chat. Let me ask it a different way. Does anybody dislike that idea? Okay. I'm gonna scoot that kind of over here. I think I do think the theme so far is connection and shared language. So a definition seems like a logical place to start. Just to, I mean, I think even in this conversation, we've identified areas of like, oh, when I say that, and you know, in my lens, that's pretty different than probably what, you know, when I say provider, that means something different to Nikki and to Natalie and to Dana. And so be some sort of, maybe it's beyond a definition, but like a definition of what do we feel like family partnership means across early childhood in Kansas. I know with the family leadership team, we had a conversation about, you know, each organization is probably going to have their own definition. I know Heather pulled one from a grant that is very specific to them. And so could there be some sort of language that's pretty basic and broad, so that people's, you know, if people have specific definitions that they need to meet for funding or for policies or for whatever reason, that like there's kind of an umbrella definition that people agree upon across the early childhood system that is like, you know, the umbrella, and then whatever else they need to apply fits within that. So I think the family leadership team seemed to feel like that would be a good approach, but definitely open if other people have different thoughts on that.
I think this is a smart place for us to start.
Okay. Do we feel good to say we want to develop this recommendation in November as one? We can have as many as we want. Okay.
I think starting with one is a good idea.
I'm going to make it a different color. Okay, great. So we've got 13 minutes left. We can either start on that one or on the definition. Like I said, I think we're working through like developing some sort of template to be able to have more of like a formal recommendation to present following November. So we'll use our meeting time next month to really kind of explain like why that's needed and go through some of the questions that Debbie shared with the full panel. So we can either dig into that, or I do feel like there's quite a bit, but we've got some other ideas here. So we can certainly keep developing those or continuing to break down the connection challenge. I think there's a lot of ideas that could be could be added on to the definition for that. So how would you all like to use our remaining 12 minutes?
This is kind of related, but kind of not. Just thinking about how do we make it easier for families? Because I don't know if any of you have seen Made yet on Netflix, but to watch her go through all the processes she has to go through, and I know that's kind of an extreme example, but a lot of those are the families that we work with. So she's got a full-time job and she says, I have another full-time job, just trying to get all these resources, waiting in lines. And so it's hard to be a parent no matter what. And then if they need some resources, we're making it harder for them. So how do we make it easier? And is that connecting the dots for them? Or I don't know, but I highly recommend Made. It is so good. I have to watch only one episode a day because it's a little heavy for me, but it is very good and a very realistic look at what families go through today.
Megan,
go ahead.
I'm sorry. Well, I was just going to share that, at DCF, a lot of those programs are the ones that we handle that were in Made, which I loved, by the way. I loved, but it was kind of painful to watch. And so, but we're constantly working to improve things. But one area that I really see that's hopeful that we're working on right now is with the K-State Extension offices. So we have Heartland that's already helping people with applications, and then they do these telephonic signatures so they can kind of work through the paperwork with people. But K-State Extension office they're looking at doing similar things. What we find is that the applications are difficult. Now, obviously, we could help them too, and we do help them because all we need is a signature on an application and some basic information like their name and address, and then we can walk them through applications, and we do that all the time. But there's a lot of people interested in helping, so that's good news.
Thanks, Vicki. Lisa, were you going to share as well? I think you're on mute, Lisa.
My experience is and it's personal, but it's almost 20 years old. But my husband and I had twins that were 10 weeks premature. And I remember leaving Children's Mercy after the social worker talked to us and said, you need to do this, and you need to call Tiny K, and you need to do that, and this, and we're here, but you need to do all this stuff. And you get home and you get overwhelmed and you got family in, but you don't know where the resources are. And the professionals call you and you're like, well, I don't know if I need that at this point. And then when you get ready to regroup, Crystal talked about the disconnect. What happens is life happens in the middle of it. And we can sit here and talk about, well, we need to do this, we need to do that in this, I hate to say it, bubble. But for the families that are living it, they don't know where to ask unless they have a physician, unless they have a social worker. And those professionals that are out touching those families are the ones referring them to these resources. I kind of have a different spin on all of it now because I lived it. And it was 20 years ago. And technology has changed a lot. But the one piece that everybody has to understand is if they have a child that has medical issues or developmental issues or whatever the issue is, they have to accept that there might be something they need to address and be willing to listen and ask for those resources. And that's not anything we can make a roadmap for, because everybody's in a different spot in their process, mental health or otherwise.
This is Kate, and I can completely identify that with that. I mean, I was handed a 3.5-month-old that had been shaken multiple times and starved. And we were given literally no resources by any social worker. You know, and I think it was even worse for us because we were foster parents at the time. And that was an even harder thing to deal with, and because number one, providers didn't see us as the parents. A lot of providers had some preconceived notions about foster parents, and so they weren't willing to give us information. And our daughter's case manager didn't know what we needed to do. And I think, you know, this isn't just getting it into the hands of medical providers, because we know that most of our foster kids in this state are lacking in meeting their developmental milestones. We know that they need more mental health coverage than most other children. They tend to have higher special health care needs than other children. And so when we're talking about, and my experience was just 7 years ago. And so when we're talking about defining providers and getting things in the hands of people that need to disseminate the information, it's just got to be statewide. It's every, like someone mentioned before, every person that touches a child in any way needs to have access to this information that they can provide to a family. And the other thing is, if it's repetitive for a family as well, that's also helpful. I'm seeing the same message. I'm hearing the same thing from my providers that my child might need this service. So I think consistent messaging is also a key piece of that. So that's kind of my take from our experience.
I'm reminded of how important home visitation is during this entire conversation too, and how helpful home visitation is. I was a teenage parent of a child with special needs. I really had no clue what I was doing. And my home visitor made a world of difference, and she's the reason I entered this field. And I did home visitation for a number of years. And I think home visitors really help parents organize and understand and follow through, and kind of can help them with managing everything they have to do.
And I agree. I think I too, like Lisa, had a baby in the NICU. One twin got to come home, but one was in the NICU. And when they handed him to me, here you go, good luck. And I had 3 other kids at home. And so I felt totally unprepared. I was not a nurse. So I know this is a different conversation because some parents come in later on down the road, but yeah, maybe a better job of warm handoffs between hospitals and tiny K services or something is something that should be looked at as well. Because I didn't have a social worker. I didn't have anybody. And I was a teacher, and I didn't realize, oh, he probably needs tiny case services. I totally didn't even think of that until he was a year old.
I'm in Leavenworth County, and they don't deliver a baby in Leavenworth County. There is not a hospital that delivers a child here. So all of those types of medical services come out of Children's Mercy in Kansas City or Overland Park Regional, the big hospitals in the city. And they hand off the information to the parent, and there is a social worker, but there's no real good communication out to the outlying areas. If you're outside of the 4 counties in Kansas City, you're kind of on your own. And I was much the same way Dinah was. They came home, and I was 6 months down the road before I raised my hand and said, maybe we need help. And when you talk about special needs kids, there are more of them out there. And I'm talking to the choir when I say this, but when the kids were in the NICU, there were 48 beds. Children's Mercy now has 102 beds in their NICU. Those are kids that are surviving and thriving and coming home, and those services are needed in the communities. So everybody asks, well, why do we have more? Well, this is why, but nobody connects the dots.
Thank you all for sharing your personal experiences as well as your professional. I think you're, I know this is a hard conversation, but I think it's also always a good reminder of the why. And I appreciate you sharing that. And I hate to cut us off, but we are due back in the full room in 1 minute. So I believe, Crystal, you're up for presenting today? Is it your turn?
It is my turn.
Okay.
I'm a little, I feel like we made this decision about shared language, and then we kind of opened up the floodgates on the need for connecting the dots. So I guess I'll just share where we're at.
Well, I will say, I think it's, it's one step at a time. And I think it can feel, I think many of us can relate to the feeling of like, we want to fix all of this tomorrow. And I think, I realize that after this conversation, saying we're going to work on a definition may not feel quite as aggressive as some would like, and certainly understand that. But I think it is, this is one step. And we can continue the conversation in November and hopefully build on it. And certainly we'll keep these boards open. So if you think of other things before our November meeting, please add them. I think the conversation is still ongoing, and no, this is not the only time we're going to be putting ideas for recommendations out there. So thank you all for your energy and your brains and your stories today. It's very appreciated, and we'll continue in November. And for now, we'll hear what the other groups have done. And thanks to Crystal for sharing about our work. All right, we'll see you back in the main room. Thank you all.